India today reported over 47,000 new COVID cases. It's the first time in 2 months that we've seen this large number of new cases. 70% are from Kerala. In fact, the daily average cases are now above 40,000 after 3 weeks, making it is a big concern. The government has said that the second wave is not over. A greater worry is that India has seen over 400 deaths a day for the last 5 months. But here's a closer look at understanding this 2-month high. Now, weekly cases are rising in 11 states, but Kerala dominates this with a growth rate of about 50% and about 30,000 cases daily. Most of the states where cases are rising see daily cases of less than 1,000. Maharashtra and Andhra Pradesh are seeing over 1,000 cases daily and are rising by just 1% and 0.2%. Therefore, Kerala now accounts for 70% of India's cases. Let's take a look at the top 5 contributors. Kerala at 32,803, Maharashtra at 4,456, followed by Mizoram, Tamil Nadu and Andhra Pradesh. So the Kerala situation remains very, very worrying indeed. Joining us now, Dr. Rahul Pandit, the member of the Maharashtra COVID Task Force. Professor Giridhar Babu joins us from Bengaluru, is Professor of Head Life Course Epidemiology at PHFI. Dr. Shahid Jamil from Ashoka University, and Dr. Anish T.S., who's with the COVID-19 Kerala Task Force. Dr. Jamil, let me come to you first. When do we actually say that India is headed for a third wave? Because there were predictions that by now it would happen. We are seeing the situation in Kerala. Is this the beginning of the onset of a third wave?
No, I don't think so. I don't think by looking at Kerala you can say that, because Kerala hasn't really finished its second wave. Kerala numbers have continued to be high, and there's a reason for it. And the reason became very clear from the 4th ICMR Sero survey, which showed that Kerala had only 44% people exposed, whereas India had an average of 68%. So more than 50% people, almost close to 60% people in Kerala were not exposed to the virus even during the first and second waves. So what we are seeing is really a continuation of that. And it's just that the Delta variant is so infectious that it has continued to infect people. Coming to India, I don't think this signals third wave because, again, going back to the Sero survey, 2/3 of India has been exposed, and suddenly everyone is not going to lose immunity to, sort of start getting infected again. So I don't think this signals anything. I think we need to be careful. We need to be vigilant. We need to be testing. We need to be vaccinating at scale.
Right.
But I don't really think that this looks like a third wave to me.
So therefore, let me put that question to Professor Giridhar Babu. Would it be fair to assume at this stage, given the pace of vaccinations, which is nowhere close to what we want, but it's been stepped up a lot, let's accept that, taking that into account, taking the low positivity rate in many, many states across this country, would it be fair to say that we aren't headed to a third wave at all, at least not in the foreseeable future?
Vishnu, the question is, when will we have third wave? Right now,
so you do believe that there will be a third wave?
Of course, there's no doubt about it.
Why do you say so, Professor?
Yeah, so if you look at UK, US, Israel, all the countries which had even more than 70% vaccination coverage, they've had third wave despite having high vaccination coverage. 1/3 of some of these infections in these countries are because of breakthrough infections among the vaccinated persons, who also contribute to the overall number of cases. So at this time, we should not be worried about the absolute number of cases. We should only be worried about who requires hospitalization. And therefore, Kerala's story is not a really scary story for me, because their hospitalization rates are much lower, their vaccination rates are good, and also they are continuing their low case fatality rate for a long time. So what's happening in Kerala is probably what is going to be a case in almost every state when there is a third wave, especially if they have high vaccination coverage.
Okay.
So I think we should destigmatize this number of cases being shown as something very scary.
All right. Fair enough. Dr. Anish T.S., is it possible to predict at this stage when Kerala is going to start flattening the curve? Because we've seen this rate of infections now for several days, and it's quite high. Is it possible to get an idea of when it's going to start flattening this curve?
Yes, I agree to the points made by Dr. Giridhar Babu as well as Dr. Shahid Jameel. So what Kerala was doing, Kerala split the entire second wave into two halves. One was happened along with India's wave, and the other is happening just our lockdown wave released, because so many people are there to be exposed. And we have got our mathematical models where predicting around 10 to 15,000 additional cases because of the Onam surge. It was a planned, calculated move that you allow some kind of interaction during Onam days, because it will give some life to the economy. So now we are exactly what we are thinking is happening in the state. Our system is not overwhelmed, but the cases have started by maybe 10,000.
No, but Dr. Anish T.S., that really was the problem. That the leeway given by Kerala, a state which has done so much to fight against COVID during Onam, was almost unbelievable. There is no leeway, sir, in this at all. There is no scope for leeway. That's why we have these numbers. And yes, people may not be dying, but none of us here know the full impact of long COVID. Who knows how?
It is not that allowing celebrations and all. We can see that even government of Kerala was not also involved in the celebrations. It was actually trying to give them some kind of life for people, especially they are selling some small goods among people or something like that. That was the only thing that has happened. But as the wave or the delta is so contagious, so that even allowing that kind of interactions will bring a lot of cases.
Yeah, but that's exactly something, sir, that we knew. We knew how infectious delta is. We've known it for months. Therefore, Onam should not have been allowed to have been opened up in this manner. We were headed for this in Kerala. It's just fortunate that a larger number of people are vaccinated. Therefore, the fatality rate is low, hospitalization is relatively low. But surely we should have avoided that. Just look at what the Supreme Court has said. But let me move away from that. I want to go across to Dr. Rahul Pandit. Dr. Pandit, the World Health Organization has warned against a booster dose at this stage, because they're saying that ethically it is important to ensure, given the lack of vaccine availability, that at least one dose goes to people, then 2 doses gets to people before we start thinking about booster doses. But we will very shortly, sir, be in a situation in India where people who've had 2 doses several months back will start losing out on immunity because the vaccine will be less effective a few months later. Why are we not talking about booster doses in our country?
Good evening, Vishnu, and good evening, everyone. I think we are actually starting to see some amount of breakthrough infections already, especially in healthcare workers. I have seen now several healthcare workers who were vaccinated and who were probably doing fine are now getting infected and coming to the hospitals. But fortunately, none of them are actually requiring admission. They come to the flu clinic, they sort of get tested, and they are being managed at home. So I think the booster dose for vulnerable population definitely will have to be discussed. Whether the healthcare workers and the frontline workers will be a part of that vulnerable population or not from the point of view of their health, but from the point of view of their exposure to the disease, will have to be debated and discussed, because we need to have an equitable distribution. I completely agree with what WHO has said. If people have not received their first dose, it would be a bit naive for healthcare workers to say that let's start giving us third dose.
Right.
But I think a balance will have to be struck somewhere, because ultimately you require the healthcare and the health force to actually work for you and not be in the hospital or at home sick. So you will have to strike out a balance for that. We also know one more thing, that people who have had disease and who have taken 2 vaccines have probably got better immunity than those who have just taken the vaccine, not had the disease.
Yeah. Professor Giridhar Babu, would you agree that, in a finite period of time, before we fall behind the world as we've done in the past, we not need to start thinking about a booster dose. Of course, that means who gets it first, etc., will be part of the conversation. But that conversation in India is slow.
Yes, Vishnu, let me break it down. The primary endpoint for testing a vaccine is to prevent death and to prevent hospitalization. Even with the 2 doses of vaccine, the primary outcome was to prevent death and reduce hospitalization. That's why we are getting breakthrough infections in those who are already got 2 doses. Now, the 3rd dose is not going to prevent the infection. It is not going to ensure, because that is not the primary endpoint at all. So what is then the question is, do you really require vaccine which is an additional dose to prevent the infection? Is that the primary endpoint? Then that is not what the booster dose is meant for. Immune response has to be studied in totality in preventing death and in reducing hospitalization. If that's not happening, whether a booster dose is required and in whom it is required.
But Professor Babu, the effectiveness of Pfizer and AstraZeneca statistically go down, the 2nd dose, after a period of time. We are not going to be getting that 75% after 2 doses, let's say 6 to 8 months later. Right?
Let me explain. Pfizer was a lower dose which is given mostly in Israel. That's why you will see most of the breakthrough infections happening in Israel, whereas the Moderna dose was higher than the Pfizer. Therefore, the number of breakthrough infections are also less in the case of Moderna. Now, they are thinking in terms of what should be the dosage for the booster dose, whether it should be same as that of Pfizer or of Moderna. So that's the discussion they are having. We need to have randomized control trials, Vishnu, to find out what is the need of the booster dose. And only in that case, there is a special scenario where vulnerable groups can be given. Right now, I think it is too early. But we should start, as you rightly said, we should start discussing about it. We should set up these studies and also identify the priority groups.
Dr. Jamil, your thoughts on India getting set for booster doses, at least in terms of a conversation?
No, in terms of a conversation, fine. we should talk about it, we should plan it, but I think we are still quite far away from starting to give booster doses. Only 37% or 38% of India has received just 1 dose. So we are far away from it, but it's never too late to start planning, to start discussing.
Isn't it a worry, sir, Dr. Jamil, that we always end up thinking, in a linear fashion? And we've seen the impact of thinking this way in the past. Whereas when other countries bought up as many vaccines as they wanted, we progressed very slowly. We have done this very fast. We will first vaccinate A, then we will vaccinate B. We will export as well, and then we run out of vaccines. When booster doses will be required, it's a fact. The question is when. That's the debate. Why aren't we already thinking actively on, or why haven't we concluded studies on Covishield effectiveness after 8 months? Is it down to 50%? Is it down to 45%? The 35 or 37% of people who've got it, right? Should they not be given a booster? Why are we delaying the conversation?
No, I don't agree that they should be given a booster just because a certain number of months have passed. Yes, I agree with you that studies should be done. People who were infected, let's say in the first wave, we don't know how many of them are getting reinfected again. So those numbers, those studies are needed. But in a scenario where we only have less than 40% people receiving 1 dose, the case for a booster dose to those who got vaccinated early on is just not there. Maybe, if there is scientific evidence that it is needed, yes, we should do it. But we should just go ahead and plan for it, plan for enough doses. I think that's critical.
Right.
I mean, you can think about giving n number of booster doses, but if there's no enough vaccine supply coming through, how will that happen?
Yeah, that's the bottom line, isn't it? Dr. Anish TS, we are all very happy in that, across large parts of our country, schools have been reopening. Now, we already have a vaccine from Zydus Cadila which has been approved for use on children. It is deemed to be safe. Why are we not again talking much more than we should on the need to get this vaccine out in large numbers, in double quick time, perhaps go from school to school? There's no injection, it's a different kind of applicator, and start vaccinating kids. Again, why are we slow in this? Why are we not talking enough about protecting our children?
Definitely, the opening of school is very, very important, and now we are started thinking about that things, and in some states it's already started educating our children in schools. But regarding the vaccination, the cost-benefit analysis, if you look, the vaccine may not be as beneficial as an adult to a child, because the child may be having lower number of infection. Even if they are infected, the chance of mortality or severe kind of COVID will be much less. So you should have a very safe vaccine for the child if you are going to go for a vaccination option. So it is very important to think about the safety of the vaccine. And the Zydus Cadila vaccine is a DNA vaccine, and it's actually a new vaccination platform. Sometimes I think people are very hesitant to use it among children. That may be a reason. And our trial is going on regarding Covaxin and all. And now also there is usually a talk or a debate that whether the vaccination is an option among children, or we can allow some kind of infection in children, because it should be very, very less severe in children, and the chance of casualty will also be very much less. So what vaccine is, we have to think more about vaccinating our elderly and people with comorbid, because this segment is not fully vaccinated, and so the mortality is coming from this segment already.
Okay.
It's already happening.
All right, gentlemen, I'm running short on time. I'd like to thank you all very much for joining us. But there is a little bit of science which is available based on data collected on the efficacy of vaccines going down over a period of time. We actually compiled some of the data. The world is facing an uphill struggle against COVID. In India, there is a fear that a third wave could hit us. New global research overturns some earlier beliefs about COVID and vaccinations. These findings suggest that our fight against COVID is going to be even tougher than it already is. One of the major worries emanating from new global research is that protection by vaccines doesn't last long. They do not protect a person for anywhere near as the 1 year previously hoped for. In fact, it's now clear that the efficacy of all vaccines drops sharply every month after a person is fully vaccinated. Consider this. The Pfizer vaccine starts with a 95% level of protection, but in just 4 months drops to a disappointing 48% protection. The AstraZeneca vaccine, known in India as Covishield, starts with about 75% in terms of a level of protection, but it drops month by month, in 4 months falling to a poor 54% efficacy. Now, this rapid drop in protection has major implications for India's vaccination program. The most important impact is an immediate and urgent need for booster shots. With vaccine protection dropping below 50% in 4 to 5 months, it is now important to have a booster 6 months or at most 8 months after the second dose. India must begin booster vaccine doses immediately. First for doctors, nurses, and all our frontline workers, then for 60+ population and those with comorbidities, and finally for those in the general population who have been fully vaccinated. Already 150 million people have had 2 doses. They need a third booster shot. The number of booster shots required will increase every month. Now, perhaps an even more disturbing finding of new global research is that an increasing number of children who've so far been considered less vulnerable are now being infected by the COVID virus. In the United Kingdom, over the last few weeks, there's been a sharp rise in the positivity rate among children. Alarmingly, almost 45% of boys in the age range of 10 to 19 are testing positive for COVID. Even younger boys between the ages of 4 and 10 have a positivity rate of as high as 35%. For girls, it's not much better. Between the ages of 5 and 19, they have a positivity rate of 35. So based on these findings, India now needs to also focus on vaccinating the 450 million girls and boys between the ages of 5 and 19. Now, this is a massive new task, but an extremely important and urgent need in our fight against COVID. Given our current rate of vaccinations and with this new need for booster shots and vaccines for our children, it is estimated that India will only reach a target of fully protecting 60% by December, not this year, next year, 2022. This makes us vulnerable to a third, possibly a fourth wave.